Hi, welcome to Care Hoax videos. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and we're talking about the causes of having headaches. So if you're dealing with headaches on any kind of a regular basis and you're not quite able to navigate the maze of potential causes, maybe you've been using those non-steroidal anti-inflammatory drugs with too great frequency, and you want to get to the bottom of this and get over the headaches. One of the causes that I think is a relatively common situation for women, Dr. Slavin, I don't know whether it's an issue for men as well, hormone imbalances. What do you have to say about hormone imbalances as a contributing factor to experiencing headaches?
It can play a role in any age group. That's the thing. It's not something that's premenopausal or postmenopausal. It could be any age group. Has to be considered not just with headaches, with any complaint a woman has. You should also keep in the back of your mind, could there be a hormonal component to it? And it's a very common thing, what we call estrogen dominance or a hormonal imbalance, very common. So therefore you ask questions, for example, when do you get the headache? Is it around the time of your period? You see, and a lot of times that's when they'll get it. Just before their period comes, there's a change in their hormones and it can trigger a headache, and then you know it's hormonal.
And another area that I think that many Americans might be experiencing without really realizing it is an overacidic body chemistry. Might that have anything to do with developing headaches on a regular basis?
Well, I think what you're really referring to is how people eat.
Yes, indeed.
And again, so then almost the common denominator for all illness is lifestyle, which encompasses how you eat, how you exercise, getting enough sleep. So any topic we talk about eventually funnels down to that approach. But specifically, we can spend a lot of time talking about how people should eat, because a lot of people don't eat the way they should to be healthy. And unfortunately, young people seem to tolerate bad eating habits better than older people. You hear, what do I hear all the time? I said, I used to be able to eat anything, and now I can't eat anything, and it's not the same. So definitely picking your foods wisely is very important.
So the things like sugar and artificial sweeteners, white flour products, highly processed foods, all of those would contribute to overacidity. And my thought process is, with that overacidity, you have an overly active inflammatory response.
Yeah, and speaking of foods, if you're not eating naturally, meaning it's not processed at all, that's the way you should try to eat, and you're buying processed foods, how do you know it's processed? It's in a can, it's in a box, it's been touched by human hands and it's been packaged. One of the spices that's notorious for causing headaches is MSG, monosodium glutamate, and they disguise that by using other names to describe it, and that's why it's always better to try and eat your food in its natural state as much as possible, rather than eating it from a can with all the seasonings, or a box, or frozen, however they do it. It's better to avoid all these seasonings, which are harmful.
It's interesting because, as you say, MSG is often hidden in the processed food, and it is certainly toxic to your brain chemistry and creating an inflammatory response. What about time zone travel? Have you ever had anyone come to you who's flying through different time zones on a regular basis, and they are experiencing jet lag and experiencing headaches as part of that jet lag?
Well, I have patients who are flight attendants, and they do that. That's not one of their complaints, but maybe they're professional time zone travelers, and they know how to compensate and adjust to it. But clearly, for some people, if you allow your body to be out of sync, for periods of time, it's just putting added stress on the body and can increase the risk of headaches.
Another one of the areas that I think may be a contributing cause to headaches on a regular basis, certainly you address to a certain extent by talking about processed food. I'm talking about mineral deficiencies and even nutrient deficiencies.
When a patient is complaining of chronic headaches every day, every other day, that's when you have to start thinking of those chronic nutrient deficiencies and maybe allowing it to happen. If you have a headache once a month, once every other month, probably other causes for it. But if you're having very frequent headaches, you have to consider that. One of the most common deficiencies is magnesium.
Magnesium will help to relax the muscles, stop spasms, and that relaxation in the shoulder muscles, the neck muscles, stopping spasms in blood vessels that are traveling up the back in order to deliver nutrients to the brain. If those blood vessels are in spasm, that can be very uncomfortable. What about dehydration?
Dehydration also could be a cause. Again, people should really take better care of their bodies. There's that old saying, take care of your body, it's the only house you have.
And your body, right back, will take care of you. You've been watching Healthcare Hoax videos, and try to keep in mind that if you visit Healthcare Hoax videos, please like us. Please share these videos with your family and friends. If you subscribe, then you'll get a notification that the next video has been posted, and you will not be hoaxed by misleading information in our healthcare system. We'll be back soon.